okay, I'm gonna diet, and that means restriction. One time to diagnose a relative with pancreatic cancer, and knowing already, like, this is very bad.
Thank you again to I Got an Accent, So What? This is your host, Gea Gomez, the one with the accent. But today we do have somebody that have an accent.
Yeah,
I'm sorry. My amazing friend, Luisa. Luisa, I saw your Nieves and I almost call you Martinez.
Oh, yeah.
Because of your husband.
Yeah, it usually happens like that.
But no, this is my really good friend, neighbor. I'm going to tell you guys the story because it's a very, very particular story how we met. And today I wanted to bring you one because, you know, you're a doctor. She's a primary care. And not only at very young age, I consider that she's a very young woman because I'm in the same round of age.
Yeah, we're very young.
We're very young and tender. But there's so much questions that I have, you know, and a lot of time we you know, I consider myself so lucky to have somebody like you here and call you even my friend, to have somebody that is a doctor so knowledgeable, because not many people have that. Right?
Yeah.
I hope that I'm not so obsessive calling you all the time.
No.
Not.
It's very, very
subtle.
Yeah.
Because she's my doctor too. I'm sorry, you know. So from a patient to a doctor. Luisa from Puerto Rico, right? You were born and raised in Puerto Rico.
Yeah.
You did your study in the island.
Part of it, and then I went to Dominican Republic. Where my dad also studied. There he met my mom. So I'm half Dominican, half Puerto Rican.
So we have two nationalities here.
Yeah.
Which do you tend more? Your Boricua side or your Dominican Republic, or both?
I think that I, having the experience of, you know, living there for a while, you know, when I was studying abroad, I kind of embraced the Dominican culture more. Yeah. And I met a lot of, you know, colleagues there. And I really embraced my part of Dominican over there, which I actually, I learned a lot more from their culture while I was there.
And I imagine in the sense of medicine, it's two different way also, because, you know, from Puerto Rico doing medicine and also in Dominican Republic, is it a little bit different, or approaches different in medicine?
There's differences mostly related to the resources. So there, for example, just because they don't have that many doctors in the public hospitals, they will throw you to the ER to see patients like from the very beginning of the clinical part of the career when you're studying. So that's something that actually puts you in a situation where you learn faster.
The hard way.
Yeah, from experiences, you either, you know, you either swim or sink.
You die.
and or worse than that, you know, people might, you know, get aggravated in their conditions. But it was very interesting because you kind of also learn that the human needs or how humanity needs more people to care for them.
Absolutely.
And there's like a lot of lack of empathy in other environments where, you know, medicine is more looked at as a, you know, career where you can just make a lot of money.
And that is a really interesting subway that you're saying, you know.
Yeah.
Especially here in America, and me, that Cuban, that the professionals in medicine in Cuba, they do that, practice that, because they really love their passion for medicine, because it's not for money. they're made peanuts. But then you come to this country that everything is so capitalized, and one of the most, if not the most expensive things here, it's medicine. There's a saying in the Hispanic industry, the Hispanic, whole entire culture with us, that we said, in this country, you better come healthy, because if you're sick, you're done.
Yeah.
Because of the whole entire system of medicine, that it's not only that it's very expensive, but, and I also get it, it's a very expensive career as well, and you have to make money somehow. There's a lot of gray lines.
Yeah.
That I guess patient and the doctor, they're like, is this doctor really here for me, or there's just for the money?
Yeah, but I've noticed patients can tell. They can tell, because being a primary care, I have to, after a patient goes to a specialist, for example, they go back to me and they tell me, their experience and, in their own words, whatever the specialist said. And many times I've had patients come back to me and tell me, I'm not going back to that specialist. He was just like, very dismissive and da-da-da. So patients do know when a doctor is, there for it, really because they care versus, or whereas it's just for the money. And sometimes, it's not like I don't judge. There's doctors that really like their money, and there's nothing wrong with that as long as they do a good job. However, I do understand that the main reason for us practicing should be, doing good for patients.
Wow. When did your passion for medicine started? When you're like, I want to be a doctor.
That's a very interesting story there, because my dad, he was a doctor. He was a primary care. He practiced for over 30 years. And he went back to the same town where he was born and raised. So, and it was really hard for him to make a name of himself, open up a clinic and everything. But all that he did because he was really passionate. And I started seeing that passion since I was a baby. So when I was 4 years old, I told him, I want to be a doctor like my daddy. And ever since that, I never doubted that I wanted to study medicine, ever. For example, my sister, she is a year older than me. She's a pediatrician. And she never said she wanted to be a doctor. When she was 16, she was still like, oh, I want to be a lawyer. And out of a sudden, it kicked her, and she just decided, oh, I'm going to medicine too. But in my case, I think I just wanted to be just like my dad. And that was it.
How old were you when you knew that you're like...
I was really convinced, as a child, you say things.
Of course.
But convinced, when I was 12.
Oh, wow.
Yeah, early. And I used to go over my dad's medicine books. And we used to gather around a book and start, seeing the pictures. One time there's a funny story where all of us were really laughing a lot. And my mom found us looking at a lady giving birth. And we were like, oh, look at her thing. We were all laughing.
The whole anatomy.
Yeah, her whole anatomy. But we like to go through the books, and at that time it was confusing, of course. We didn't understand much of what it's written there, but we were all curious about it.
It was impregnated in you due to your father's passion.
Yeah.
And that's something beautiful. Parents, don't give up on your children on that, because when they'll let you know, hey, this is something that interests me, just guide them through there, Now, question that I get to ask you. Holistic or traditional medicine?
Definitely needs to be a mix.
Really?
Yeah. Because actually holistic is just the whole, but then alternative medicine means that you use other things that are not medication, specifically. Like, for example, acupuncture, meditation, different,
having herbs.
herbs, oils, vitamins, different modalities. And of course, there's the traditional medicine where you have the all the chemical medications. And there's always, like I say, whenever something can't be improved with something alternative, then we have to use medications. However, myself, I honestly like to try the alternative first, and lifestyle modifications, because a little bit of improvement in your diet, moving a little more, goes a long way, because it's like accumulative. It's like synergistic. It doesn't just happen from one day to the other, but if you really keep consistent, it goes a long way.
So it's a perfect balance if you use both. But what I'm getting from you is like there's some instances that we have to go in with everything, with all the chemical compound, because something has to.
Yeah, there's no other way. Like I've seen cases where people recover from cancer using both.
Exactly.
Because when you are treating with so hard chemicals, your body just suffers in other areas. And if you support those other areas while you are treating the cancer, you get better outcomes. And those, other alternative treatments include diet and other, supplementations. And also, even people sometimes think that health is very complicated, but keeping yourself healthy is not that complicated if you just follow the most simple things that are elimination, which is like, if you drink water, you of course have to go pee. Whatever you're eating, you have to put out. Your digestion is very important. Sleeping, and of course moving. So if all those are in place, you will keep the balance of your body, and things won't get as bad as if all of them or most of them are out of balance.
So your natural body functionalities have to be going, because we all know and that this perfect machine that got made, he made it perfect for something.
Yeah.
But there's a lot of things that we're exposed in the environment, that obviously make that machine not run correctly. Yeah. And not to even mention that, things that we inherit from, family to family, that they never reinforce that, especially a whole entire clinical thing of diabetes and stuff like that. And it's funny because I did do some iridology. I studied that when I was right before I had Gianfranco, because I couldn't get pregnant. And with iridology and holistic medicine, I was able to get pregnant with him. And I learned so much of how everything is a domino effect. And how can us mom stop a whole entire generation by how we take care of us before we get pregnant, to stop that chromosome to create the same default, la misma falla that is in there repetitively. And having said that, we are bombarded by so many diets, right? Diet this, now we should do this, now let's go all keto, let's go all vegan, let's go. But I think, and this is a question that Leticia and I were like, how can we put this in perspective? And it said, we were like, how do you think, how do saying that I'm doing a diet affect the individual?
First of all, the word diet is misused, because diet is whatever you eat. You can have a bad diet, a hypercaloric diet, a hypocaloric diet. It's just about everything you eat. That's your diet. But with the misuse of the word, people say, okay, I'm going to diet. And that means restriction. Stop eating junk food, for example, candy, and all the bad stuff, which is not bad. However, whenever someone says, I'm going to go on a diet, immediately their brain starts to feel like, oh, I'm going to be restricted. And then that emotionally,
I'm going to be disciplined for something.
Yeah. and that puts people immediately like in this state of they are craving everything they shouldn't be eating.
Wow.
Even more when they are actually not on a diet. So it's a word that I don't use a lot. I usually tell my patients that they need to improve the way they eat, and they ask, oh, what diet should I do? And I tell them, stay away from processed foods, everything that comes in a package, in a can, or of course, if there's an emergency and, those type of foods you have to use.
Yeah.
But on the regular basis, just things that will not decompose are the things that you should avoid. Like if you open up, for example, a pack of or even not, doesn't even have to be open up a packet of fries or chips. Many times, and we've seen that people do experiments with the fries from fast foods. If you put them like to see how long they last, they will like dry up and never get fungus or anything. Yeah. So those are things that let you know that there's something in those, there's chemicals there that do prevent that from, and as you eat them, then your body doesn't even know what you're putting in.
Exactly.
Besides the calories, you are not getting nutrition. And that's the important thing. Dense nutrition is only found in, whole things like wholesome fruit, veggies, meat, poultry, and even carbohydrates, which are being demonized lately. But we do need a small amount. The thing is, we Hispanics, we are very high, and we're fans of carbohydrates. Like rice and beans, both together is like carbohydrates with carbohydrates. Some of them, some people think, oh yeah, but the beans they have protein. They have a really tiny amount of it. Most of it is carbohydrates. So it's just having a balance. Our plate usually, and I use the plate method a lot because I explain it's more simple, because if you have to follow a specific menu, like 3/4 of a pound of this, it's too much, or ounces. And some dietitians will be like, no, yeah, you have to you have to weigh your food and stuff. However, if you are not looking for a specific goal like weight loss, and you just want to be healthy overall, the plate method works really well, which is having half of your plate full of veggies and green leafy vegetables and other type of vegetables like broccoli, cauliflower, carrots, squash, zucchini, and 1/4 should be your protein and 1/4 your carbohydrate. And of course, what you drink, water all the time. That's the better, liquid that you can have, water.
The one that we know what it has and what comes out.
Yeah.
And that's another subject for another day, because then it's like, what water can I drink? Because we can go here for the alkaline, the this and that. Oh my God. It gets to the point that I think we have so much borbandeo, is like a lot of so much over information that you get scared of everything. Like, am I even allergic to air because it's like water? Okay, no, but now you cannot just have water from plastic a container. It has to be in glass. And I understand that there's better ways, but I also understand that we also have to be very practical with nowadays. That you can be so holistic and have everything as less processed or mechanically I guess worked on, but then we're on this or we are next to the microwave because we have to heat up our food. So I understand there's a balance. Now, one of the biggest factor, and it's easy because the doctor told us, yeah, you just have to control the stress. So the big word, the big stress, and a lot of people take it lightly because we understand that stress is something that we sometimes feel or feel overwhelmed. But how deep did that go?
That's a really good question, because levels of stress and the reasons why people stress, they vary, a lot among people. So people, I've had stay-at-home moms that will get stressed because they haven't completed their tasks during the day. I have high, executives because they, have too much meetings and stuff. So stress is something that it's very individual, and many people might feel stressed for a significant amount of things or for very simple things. And everyone's mind works differently. But as soon as a person understands how their mind kind of works and how they get stressed, then they can start working on different techniques on how to manage their stress, because stress has been linked for a long time with chronic conditions, hypertension, even obesity, because of the cortisol levels. They increase when you are stressed, and then you will stop, your metabolism will get messed up with the cortisol. So one of the most important things is understanding what gets you that stress, and start working one thing at a time. For example, and this is me personally, at some point I was working for a medical company, and I will find myself behind because they will put patients in a very short time schedule. And they wanted me to do a lot of stuff, and I wanted to give the best quality of care. So sometimes I will be backed up 30 minutes, and then I will be stressed because I was already backed up. And of course, I knew that when I walk into the patient's room, they might be already mad because they waited a little extra. So I decided, okay, I'm not going to stress about it. I'm just going to apologize from the very moment I get in. So that will shut down that specific stressor. And of course, things will run smoothly. Sometimes I will have to take a break. I will feel how my muscles start to get tense, and I will take a break, 5 minutes, go outside through the back door and just, stand there outside, breathe deeply, and go back in. So it's having small moments and adjustments. But one of the most important things is sleeping. You can have all the stress in the world during the day, and if you have your good, and I'll say 8 hours because that's my usual. I think everybody should have 8 hours. Once you have those hours, your body definitely recovers. It's like magic. The next day, you're ready for the.
Wow. So 6 hours won't do it?
Not really.
Jeremy won't do it. You heard? Don't be giving me 6 hours. Okay, so 8 hours to able to recover. It's very curious what you said, because a lot of time when we come as you guys from a standpoint of knowledge and authority, that we feel like you guys have it all figured out because you have a level of knowledge that we have no idea, so many years of studies. But for you to actually be vulnerable, said, I have felt it in my own practice, helping other people. And how can I tell them, don't be stressed out when I have to deal with it personally? And what you just said, that each stress level is different to our capacity, what we can handle. And give it to you on that with stay-home moms, that's a stress that never goes away. That's you put those kids to sleep, and then you don't even have time.
And then the next day is just
all over again.
Yeah. And maybe they have all figured out. They have their schedule there. They know everything they have to do. However, if something happens throughout the day that might, interrupt their flow, they can feel stressed. And there's people like, oh, but you just a stay-at-home mom. Why would you be stressed? It's just the level of excellence that they want to perform as mothers and wives that make them feel stressed. And you have to be, you have to understand that could be possible. Even I have stay-at-home moms and many times elder people. Oh, they're stressed because they cannot clean up their houses as they used to. And that makes them stressed because in the past, they could be like, sweeping the floors the entire day. And now they have to look at their floors dirty just because they can't do it anymore. And for me, that's something that I would think like,
how silly, but we don't know.
I wouldn't care. But if they were brought up, and they were raised like that was their responsibility, they'll feel stressed for silly things like that.
Of course.
So, validating their emotions, that's something that goes a long way when you are talking to people that is talking to you about how they feel, how they are feeling physically. And when you kind of, put the pieces together and you notice there's a lot of stress going on, then you have to also try to address that and help them out a little bit.
Absolutely. And I know we're tipping just a little bit here and there, but this is a very broad topic, especially stress, because it's defining it, how to acknowledge it, accept it, and then how do I do, and the little changes, what you said, those little changes that can modify, that you can say, okay, I can handle this, but let me take a little more from my plate so then I don't feel this. And the sleep that you're saying, that it's so important. How it's important for us, mom also, and parent, to help our children recognize of that 8 hour, it's very important, and to have a routine. So when they're adult, they don't have other sicknesses that go along because of pattern that they created.
Yeah. And the patterns are created from a very early age, with the electronics and the TVs. And one of the things, there's something called sleep hygiene, which is making sure that you are preparing to go to bed. And instead of going to bed with maybe your phone with the highest brightness, or having your TV in the room, in the bedroom, those are things that if you avoid and you kind of prime yourself to go to bed, it goes a long way. And if you do that with kids, it also helps. Like for example, having their any electronics, let's say they have to go to bed at 9. At least from 8 p.m., just grab everything from them and make them maybe have a shower or read a book or something that will not, stimulate them more.
Yeah.
And us as adults can, of course, benefit from it. And I usually, because I get the complaint, that's a very, very usual complaint in primary care, I can't sleep. And many times it's stress, and some other times it's just they don't have a good sleep hygiene, and I teach them a little bit about it, and many times it works, but sometimes it has to go further. Like I tell them, try to do like sleep meditations, which are like guided meditations where you just told to deep breathe in, breathe out, and it just helps them get off their minds, and that way they just with their minds blank, they will go to sleep. Some people pray, there's different methods. If it's more like, I don't want to be intrusive in terms of religion, I just tell them meditation. But I tell them, if you have a specific belief and you want to pray, that's another thing you can also do.
And let me tell you, it does work, guys, because you guys know my beliefs, and it's 200% correct on that. if I stay with my phone, I will be longer because of the overstimulation that there is, whether it's TikTok, that we know that's a rabbit hole, Instagram and all those platforms that have. But I actually have a routine to go to go to pray in my closet, and I take my Bible. Oh my God. I'm waking up myself in the middle because I'm like, oh my God, I just fell asleep. Oh my God, please, I'm sorry, forgive me. Just making a joke of that. But if you have issues going to sleep, if you grab that Bible or go to, or go into a prayer, I guarantee you're going to start falling asleep. Because your mind, it's setting up into going over all your thoughts that you have throughout the day. Having a gratitude heart help us so much. Now I'm going to the spirituality, but it goes a long way for us to be grateful. So I do believe that when we're grateful for having the day, even acknowledging having a hard day, that you say, wow, I made it. Because we can be grateful, guys, and had a horrible day, let me tell you. I acknowledge that I had a hard day, and wow, I made it. I didn't think I was going to make it to my bed today. I've had many days like that. But having that heart of gratitude that I need to release everything so I can have a good night's sleep for tomorrow to go even harder and be a better day, it changes. Those are big little changes that will be big transformation in you guys' life, in your, not only your personal life, but in your children's and your family. And try those. I'm gonna definitely do the hygiene things. Now, how do you do to disconnect from your profession, that you have so many people that come at you with help, like they need help, and I'm sure they're not things that they fix, the things that are messed up in their life health wise. How do you as an individual do to disconnect that so it doesn't affect your personal life in your household? How do you guys do that?
Honestly, whoever tells you they get to disconnect completely, they're lying.
Yeah.
Because there's always some situations where, as a human, you get involved, and if you just feel for them. However, if I do feel stressed because a patient is going through something very difficult, or if I'm sad because a patient is going through something very difficult, I just tell my family when I get home, this is going on and I'm sad. I've had patients, like elders, even though I knew they were eventually going to die, I will feel really sad and even cry about it. But I just keep my family in the loop so they know that it doesn't have to do anything with them. And of course, I just let myself feel whatever emotion I need to feel at the moment. Because if I do not do that, and I used to, have like suppressed my emotions a lot, and I noticed that I was very stressed, and sometimes even I was like mad, like
we reflect into the family. It's not their fault, but I'm mad because this is happening and they don't know what's going on.
And many times like because of how my dad created his practice in the very town that he was born and raised, and we were raised in the same town, so a lot of people, and there's even relatives. So having, for example, one time to diagnose a relative with pancreatic cancer, and knowing already, like, this is very bad, this person will likely die from this, and there's nothing I can do about it. I can't cure this person. It was very frustrating for me, and I actually had to feel what I had to feel about it. I cried and I felt very mad about it. But then I just go back to, if I can do anything about this person, then I just have to let it go and go to the next one, because there's not only one person that needs me.
Or your patient needs you.
And of course, And this is something that I have, when I was, this is very interesting because when I was studying medicine, I went to church for the first time. And I wasn't practicing, but like I was, congregating and stuff, but I wasn't like putting into practice the knowledge in my professional life. And it does make sense to do it because, when things get out of your hands, it's because because God is in control. You can't control whatever God has in plan for that person. And if you just accept that, it takes a lot of that stress and guilt and whatever you might feel when you can't do something for a patient. Having to acknowledging that God is in control and there's nothing you can do regardless. It puts you in a very different situation. So that's something I've been doing more consistently.
I love that. I love that. If you have an opportunity to see the 12-year-old Luisa and have her right in front of you, that little girl that was playing with all those tools of daddy's, medical, tools, and see yourself now, what would you have tell her?
That's a tricky question. Because some days I feel like, oh my God,
what do you choose?
yeah, like this is hard, But at the end of the day, it's so rewarding. As a human being, it's rewarding because you get to really humanly do something for another human being.
Yeah.
And one of the things I will tell my 12-year-old will be like, if you feel it in your heart and you really feel this is your calling, keep going. That will be it. Because it wasn't easy. It was really hard to complete the med school and everything. But I can definitely say it was really worth it. And not only completing my career, but keep on learning. I always tell my patients, I learn from their experiences. I learn from a lot of things. If you put yourself into that situation where you can definitely learn from anybody, it does feel really different. And I will just say that it's worth it. Every single day is worth it.
It was worth it. It was definitely a calling. And for you guys that are curious, I'm going to tell the story how we met, Luisa and myself. It was I would say it was a heavenly assignment, because it was just, every time I tell people, it was funny because we've been living in the same neighborhood, and I walk when I had my seizures couple years ago. Until today's day, they couldn't figure out what it was. I got a standpoint of just walking, I was like, let me not do weights or whatever. Go figure, go walk in the heat, right? So I started, and it's one of the things that I enjoy the most is just walking around our neighborhood. And one day there's this, what is the breed?
Australian Shepherd.
Australian Shepherd. My producer tells me she's going to kill me because that's a breed that she loves. And there's this beautiful Australian Shepherd mini one come, and I know exactly where he belonged because he was always in this backyard, and his eyes are like beautiful. He has this blue eyes that is like the sky. Like sometimes you feel like he's blind because you don't know the white from the blue. He's gorgeous. Neil is gorgeous. So all of a sudden I see him loose on the street. And I go, oh my God, I know where you belong. So he started following me, like he knows me. And I go, okay, here we go. So I take him to your house. And then you open the door, and I'm like, here's the dog. I'm not a very intrusive person with my neighbors. I'm the worst neighbor in the whole entire world because I'm not like that. I'm just in my things, in my house. I'm just not that type of, until you get to know me. Anyways, so the funny thing is, like, she found me on Instagram And she's like, hey, by the way, I'm a physician intern. And then there's some product from Peru, because Jeremy's from Peru, that they're amazing and they're super holistic too, because everything is so pure. And you were offering me, and I was like, oh my God, let me look into the company. And we created a relationship through there.
Yeah, it was really.
And then another time I'm in the mail, picking up my mail, and there's this guy that is approaching me with his yellow ribbon, and I'm like, okay. He's like, hey, by the way, I just want to tell you, thank you for saving my dog. And I'm like, oh, okay. Yes, my wife got a loose, and that's my baby. I'm like, oh, I'm sorry. He was mad. And I'm like, and all of a sudden he has a real estate license, and now he's part of our team. So we created, all of a sudden we connected so well, and it's just been so fruitful and so holistic.
Yeah, holistic.
Awesome, in that sense. But now I know the reason, and now I know, because I see your heart and how you speak about your calling. That is not just being a doctor. It's beyond. It's caring, because that's what your father put in you, and that's what you do with others. And any question, guys, you guys know that I want you guys to know that this is an open space. For any question that you guys have, write us down. I'll bring Luisa again, and we'll talk about it. Any system or anything in the body. Remember, I'm not a doctor, but we can talk about it and debate it, because we're here to help you guys. We're here to talk about things that sometimes we have no idea, or because we have to pay very high copay to get an answer for a doctor that probably goes in, and then there's this nurse that come in and we never see him again. And doctors like you, they're very few. So keep doing what you're doing. Thank you for coming.
Thank you for inviting me.
No, absolutely. Thank you again, guys. It's been an honor to have my amazing friend and doctor. I have my doctor. She's my neighbor here. But thank you again for coming to this space, which is your space, and bringing so much knowledge on things that we need to change, and we need to be proactive into it.
Yeah, and one last thing I will say is, it's not that complicated. Mm-hmm. It's easier and more simple than what people think. If you start looking for a lot of answers, just go to the basics. Mm-hmm. Like I said, a good night's sleep, making sure you move a little bit, eating as best as possible. Mm-hmm. And managing stress. Those things will go a long way.
I think they will a whole lot more.
Yeah.
So let's start from basic, guys. Let's try not to be doctors from Google. Googling. I know a couple here that, they hear the dogs, breathing hard, and they're already Googling what condition they have. Yeah. Don't do that. That brings more stress to yourself.
Definitely.
Good night's sleep, hydrated, walk a little bit in your body. It's amazingly grateful for that. Thank you, my amazing people. Again, don't forget to subscribe, to share, to comment in all of our platforms. Can't wait to see you next time. Have a blessed day.